Kathleen Wilcox, and I'm really nervous, so I hope you'll understand what I'm saying. This is out of the comfort zone for me. I heard that even in the opt-in, the premium cost would go up. My concern is obviously cost, not pass the bill and tweak it as we go. It's going to cost $2 billion to start this program, and I'm wondering where the $2 billion is coming from, and $2 trillion, $2 trillion, and I'm wondering where the money is coming to start this program, and if it's a loan, isn't that considered part of the deficit? Because I did watch President Obama 2 weeks ago say that not a dime will be added to the deficit. And I'm just curious as to where it's coming from.
Okay,
I'm sitting down because I'm nervous.
Okay, well, I think maybe when you talked about the opt-in, are you talking about the co-op? Is that what you're talking about, the subject of the bill that's coming up in the Senate tomorrow? The co-op, you are correct. I mean, in most places, most states, and certainly nationally, there is no co-op that exists. The co-op notion is one that has been floated as a substitute for the public option. And it has not been met with a lot of reception. Is that what you're talking about?
You're talking about
the opt-in. Oh, the public option. Okay. Right. Well, the public option, I think we've talked a lot about the public option and the differences that we have. I don't think that you will have a fair playing field when you start mandating what healthcare must look like from Washington, and you're going to have Washington be a competitor in with the other plans. But you've got a state-based regulated healthcare system in this country, and then you're opposing some federal player that allegedly operates without any expenses. It's just counterintuitive. But the Senate is then putting forward a bill tomorrow which is instead premised on a co-op. And it's similar to the exchange issue in exchange provisions in the H.R. 3200 bill. And essentially it says that people should have access to a co-op that will provide a forum, if you will, for insurance companies to offer their plans to people. The problem with the Senate plan as I see it, and we'll see more about it tomorrow because there's, I think, 564 amendments already offered to the bill that hasn't even begun debate tomorrow. But the problem with that is, again, you start from the point of mandates and requiring that healthcare look a certain way. And if you do that, you also have to start the co-op with federal funds. What happens if the costs get out of control? Who's going to take care of the shortfall? It'll be the federal government. So again, we need to really look at what our system is about today, which is largely outside the Medicare arena. We know the fixes we got to do there. Outside of that, it's largely employer-based. We need to take, Bobby says that, well, employers' costs have gone up. That's true, but there are models out there that have indicated certain employers have shown they can keep costs down. We need to put flexibility in place for that to continue to happen and get people, patients, more options so we can have more competition. And those options are consumer-based health care. Those options have to do with larger risk pools across state lines, etc.
In response to that, I wasn't quite clear on co-ops. I think we may be agreeing on that they have not been well received because every time they've tried a co-op, the thing hadn't worked. I think there's one in Wisconsin, and in the Wisconsin area, that actually has been around for 30 years. Everywhere else they've tried them, they kind of float along and then they collapse. So that has not been viewed as a real, strong, viable option to compete with the private sector to keep costs down. The public option, we believe, will work because we have a model Medicare, and that's, I think it would have been simpler if they called it a Medicare card rather than public option, so people would have a better view of exactly what it is. But we have experience with that, and we know we can keep the cost down, and that low cost will drive the driver, will force competition to come down to that. You're not telling them how to reduce costs. They have to reduce costs. In terms of the startup for the public option, the money will be borrowed to be paid back. The way CBO scores that, if it's a loan to be paid back, the scoring, the cost of the government is scored as whatever they think might not be paid back. Student loans, for example, you don't count in scoring the total of the student loans, you just score what isn't being paid back. So if it's expected to be paid back, the deficit scoring is negligible. Because it's a loan, there is no advantage over the private companies which have to raise the capital to get started. The public option will borrow the money to get started and have to pay it back.
Yes, ma'am.